World Field Epidemiology Day 2025, it is worth taking a step back to reflect on the immense contributions of field epidemiology training programs. Since their inception in 1951, FETPs have been a cornerstone of public health preparedness, equipping over 22,000 graduates to tackle diverse disease threats worldwide. As global health security concerns have intensified, FETPs have become increasingly relevant, playing a vital role in national, regional, and global preparedness and response. Their role and importance are recognized by the most recent version of the International Health Regulations, which sets targets for field epidemiology training. Similarly, the Global Health Security Agenda, which launched in 2014 to support the implementation of the International Health Regulations, recognized FETPs as an important element in strengthening health security. The recent COVID-19 pandemic further highlighted the need for FETPs and prompted renewed calls for significant investment in this essential workforce. The relevance of FETPs should also be seen against the backdrop of the current financial and funding landscape for global health, where cuts have been brutal. In just 7 months, the US slashed billions of dollars of funding, including 83% of USAID programs. This has left international NGOs scrambling as staff are slashed, yet FETPs need to continue to expand. Furthermore, many developing countries depend heavily on financial aid to support their national budgets, including FETP. In a separate effort, UN Secretary-General Antonio Guterres is introducing major reforms through the UN80 initiative, following the US funding cuts. From September 22nd to 24th, as world leaders gather in New York City for the UN General Assembly and Climate Week, there will be bold, news-driven conversations on the future of global development. Global aid, including global health funding, is at a crossroads, sparking debate over whether this is just another dip or a true turning point. It is against this backdrop that the world is experiencing a surge in humanitarian and health crises that are relevant to FETP. These include humanitarian and health crises in Sudan, measles outbreaks in war-torn Ukraine, diphtheria in Somalia, pertussis in the region of the Americas, famine in the Gaza Strip. Yellow fever is spreading into new regions of the countries where it has historically not been endemic. Oropouche fever in the European Union. Chikungunya in France and Italy. In fact, in France, there have been 23 chikungunya outbreaks with 115 cases reported up to the 12th of August 2025, of which 6 outbreaks have been declared over. Malaria has been considered eliminated in the US since 1951, yet approximately 2,000 cases of malaria are reported in the country each year, most of which are imported. In addition, there are now increasing cases of locally acquired malaria in the United States. So, in a world of evolving crises, we must not only face the challenge, but we must forge our own path. Now, more than ever before, it is time for us to make our mark and show the world what field epidemiology in action truly looks like. Thank you.